Okay. Hi, my name's Emily.
My name's Anthea.
I'm Mackenzie.
Okay. Okay.
Cool. So we are doing the discussion today. I am going to read the question. So we were supposed to watch that video and do read over the workplace stressors and things like that for notes. And it was just the first thing was said, discuss how your conversation with Mr. Davis would go regarding scheduling an ambulation session.
Pretty much, if we're gonna just start there, I feel like he would just want to know what time he would be ambulated and then who's gonna help him and how he's gonna do it. I mean, we don't know why he really was admitted or what the case was, but we just know that based on what he said in the video, he needs to be ambulated. But I think the discussion would go from what time will I be ambulated, who's gonna help me, and then where are we gonna walk? Like, is it gonna be around the floor? Are we gonna go outside, or where are they gonna go?
I agree with that. I also think, sorry, it's my dog. I also think letting the patient know, get away, go. Letting the patient know what is like happening, not necessarily doing HIPAA, obviously, right? But violating HIPAA, but also letting them know, hey, I still have to finish my med pass. I have to discharge a patient. I have to bring a patient from a different floor back here and things like that. So I think just keeping them in the loop also makes the patient trust you as a nurse, like understanding, listen, like this is going to happen. I want you to work with me and I'll work with you. You know what I mean?
Right. Like they understand your situation when you do explain it. So they're not, they don't feel like you don't care about this session, because I mean, it is, just ambulation, and he may be thinking, oh, there might be other important things, but he, like, when you do explain it like that, he's like, oh, she actually, is gonna come back and she's not gonna forget about me, hopefully.
Right.
I just feel like patients also need to, or not need to, but I feel like sometimes I think that you're only taking care of them and maybe one other person, when in reality ratios are so crazy nowadays, where they have to understand that you're not just the only one. Like, yes, we'll give you client-centered care, but there's like four others of you, and with different classes and different priorities. And so I think that's one thing that, patients, I mean, we don't expect them to know what we know when it comes to that. But I feel like if we educate them, just like Mackenzie said, and let them know you're in the loop, this is what's going on.
Right.
And I also agree with you though, when you were saying about a time. I mean, it doesn't have to be a specific time on, at 3:30 exactly, I'm gonna, help you move around but like within 2 to 3 hours, I or my nursing assistant can help you ambulate throughout the unit. You know what I mean? So I agree with what you're saying, keeping them in the loop of a time frame so they're not like constantly on their call, like constantly just like being nagging and stuff like that,
Right. And not like that really kind of ties into the first question too. You'd like to
you're right. Why do you think Mr. Davis responded to Alicia the way that he did?
Yeah, I personally wrote down that he responded because he had been waiting who knows for how long, and no one's actually told him what time, and like, or he doesn't understand that Alicia is short staffed. As we saw in the video, she was like asking the CNA, but he's like, oh, I'm the only one today. So I think that's why he responded the way he did, because he doesn't understand that aspect.
Right. And like, I know some people, they're different personalities. He may be that type of person that also thinks that, oh, I should be your priority. I'm your patient right now. Like, you need to do this right now, kind of thing. And like what we've been saying, if she just communicated to him all the things she needs to do, I mean, she kind of did, but she kind of did it in like a quickly kind of thing, like, oh, I have to go. And like before he was even finished asking his questions, she was already like almost out the door. Like her back was already turned. So I would have been like, well, do you have any more questions? Like, do you have any concerns? Like, are you worried about something? Just something like that, I feel like would have made him feel a lot better and less like what's it called, like a less of a burden to her, if that
Right.
makes sense.
I agree.
I wrote in my note that he honestly, to me, didn't sound angry or agitated by the way when he asked the question and his response, like his emotion, like his physical facial expression, versus when she was saying like, I can't do it right now, but I'll do it like we'll do it later. I thought honestly that he was super like cooperative. I didn't think he was annoyed with her. Like, of course you're going to be annoyed at the situation, but at her, no. Because I think he understands without you saying like, oh, I'm so understaffed, I can't help you. You know what I mean? And she was being as positive as she can without trying to sound like she's whining. You know what I mean?
Right.
So I agree with what you guys are both saying.
Yeah, I mean, it could definitely be interpreted in many ways. Like each person interprets like actions differently. Like this nurse could have interpreted it positively, but then the next one could have interpreted his, like like his surprised facial expression as something negative.
Right.
He could have, done something negative back.
Right. Exactly.
I agree on that.
Okay. Next question. When staff resources are low, what might a charge nurse consider to maximize staff efficiency?
So I feel like the most important thing is to be kind of positive about the situation and be optimistic, because once you start getting aggressive and angry, it transfers to everyone else, and that really lowers like production throughout the day. So being optimistic, positive, and like encouraging your staff to do the best they can, and if really emphasize if you need help, please like don't be afraid to ask anyone, even like the charge nurses or the higher ups, to help with the situation, because like there's nothing else they could do.
Okay. Yeah, I agree with that.
I had put down like a whole different scenario. I had wrote down like a charge nurse may have another floor nurse come down, but then as I kept going through the whole ATI thing, it did mention that sorry, I'm looking at my notes, that it's mentioned that floating nurses are considered still a work stressor, because if you float from a different floor, you have no idea where everything's at, how they're on the floor. So like, I was thinking, oh, maybe we can maybe this option can help with maximize staff efficiency. But then as I kept going down, like I said, I realized that it said no, that they can actually be a stressor. So mine's not like the complete answer to the question, but it was at first. So that's the way I went.
For me in my note, I put as being a charge nurse, you're a resource for nurses who need help, who are stressed, who have questions. You're like there to answer, be helpful, things like that. So if the charge nurse has time to help with what Alicia needed or needs, then she could have totally, volunteered herself to go, hey, let me go grab this patient and I don't know if you can administer, like a different nurse can administer a pain medication, but I think she can if she's the charge nurse.
To be honest, but
I'm not sure. Maybe, I guess it depends on the policy of each place.
Yeah, exactly. It would probably depend on the facility, but a charge nurse could definitely go and bring the patient down from radiology and help in that aspect instead of or even ambulating does not take that long. It could probably take 10 minutes for the patient to go around. So if she did have time, if the charge nurse, a way to maximize would use herself as a resource and be physically available for her,
And when the doctor came up to her and was like, oh, this family needs, education on discharge and stuff. I feel like as a doctor, if I notice everyone is running around and like staff efficiency is super low, you're just explaining discharge procedures. It's not like you're administering medications. You're not, doing other things. You're just talking to them, and it shouldn't have taken him more than 10 minutes maybe. So I feel like Alicia should have just been like, hey, like I can't do that right now. Could you do that, please? Like it shouldn't take more than this amount of time. If you need like resources or things to say, I can give you, tips or like paperwork that will help with the situation kind of thing. And I feel like a lot of places, I mean, I know it's kind of something a lot of nurses say, how we say, oh, doctors don't do anything, they just come in for 5 minutes and then leave and then diagnose things. I feel like that's kind of true in most situations, unfortunately. So I think nurses need to kind of, like, even though they are a little bit higher up than them, they still need to do their work, if that makes
Right.
sense.
Yeah.
Mhm.
There. Yeah, I agree.
What should Alicia's priority be at this time and why?
I had put that her priority should be finishing handing out medications because we don't know if there's a patient who's like blood pressure's through the roof. We don't know if just the scenarios, I guess, like if someone's pain is like 10 out of 10 and they're like whining and they're like grimacing and they're just not okay, compared to someone who's in pain, 10 out of 10 pain, and then you have someone who's just waiting to be ambulated. I think this is where prioritizing is a big thing. You have to know which patient is urgent versus which patient's not.
Yeah, that's what I said. I said triage. So understanding what is top priority, which is obviously the med pass, because certain medications need to be due at a certain time, 30 minutes before or after that allotted like time it says. So that's, like you said, number one important, because it could determine like the difference between a 160 blood pressure versus like a 110, you know what I mean? And can be potentially damaging. So I think understanding, like, maybe walking a patient isn't as important
Mhm.
in this exact moment versus someone, like you said, who's in pain, or someone who has a life-threatening medication that they need to be given, you know?
Right.
Mhm.
And I pretty much said the same thing. It's like their health depends on these medications. Like you said, it's life and death, and it's, oh, sorry.
All right, that's me too.
But yeah. All right.
Cool.
Next.
What would you do to ensure that Mr. Davis is ambulated, medications are passed, and he receives discharge instructions and transported from radiology?
Um,
I said to delegate if she
yeah.
can.
Name.
If she can.
I was like,
You
I
know?
was in
That's
there.
what I said too. Like, to tell that CNA, like, after you shower him, please go take Mr. Was it Mr.
Davis.
Stevens from radiology to his
Yeah.
room, and then
Yeah.
please go ambulate Mr. Davis, and then like the rest could be like she could do after, because you know how the doctor was saying, oh, there's only 30, they only have 30 minutes, like you need to do this within 30 minutes, and I was like, it's not her job to um kind of accommodate the family in that sense, because they decided to get a ticket, like a last minute flight ticket in 30
Mhm.
minutes.
Yeah.
It's like you can't really rush something like that.
Right.
I had also put like the last thing. I know maybe for me, I just put that discharging would be like the last thing, just because they already got, their treatment. They already got
Right.
everything that they needed to get. So that's what I said.
Right.
Yeah, I agree with both those. Okay, what nurse behaviors would you use to ensure all clients receive care as required? So for me, I said that patient-centered care or client-centered care, which is treating everyone as an individual rather than a number, and rather than, like I said, a room number, you know what I mean? And
Mhm.
also showing compassion instead of being stressed is key.
Yeah.
Fake it till you make it, you know what I mean? Like, if you're stressed, don't show that to your patients, because
Yeah.
they will feel the stress on themselves, and then they'll be agitated and, you know.
Right. And then I also just included like we should be able to prioritize situations too as
Yeah.
well, like we've been saying this whole time,
Yeah.
like what the most important is.
Well,
Like, they're all important, but
Right.
I said the same thing as Mackenzie, just keeping a positive attitude, positive self-image, because they do feed off of us. I also said emotional equilibrium because just because she is the only one, I mean, from what we saw, she can easily just her emotions could be bouncing back and forth, and she just needs to know how to balance that.
Yeah.
That's what I put.
Okay. What is an eventual outcome for Alicia if the client care expectations are not met?
I just put that the clients would just get more frustrated. like
More
if
frustrated, more money comes out of their pocket, out of possibly not even covered by their insurance if they're not able to discharge that day. How
Mhm.
much is it for an overnight time at the hospital is probably a lot. So I
Mhm.
can be annoyed at that situation.
And it could be an issue with the patients blaming the nurse or the staff or the hospital for negligence. And
Yeah.
a
that's
lot of
true.
people, like you said, they complain a lot, and that could be shown as negligence. Be like, okay, why didn't you, help this person ambulate in a timely manner? Like, you have
Yeah.
no reason to not be able to do that, if that makes sense. Like, yes, we
Yeah.
do have a lot of things we do have to do, but we have to be able to do it, and we need to find ways to
get it done on time.
Yep, exactly. Like, I mean, it takes practice. You
Yeah.
know, it'll probably take us a couple years to not be stressed every single
Right.
day for work.
Bullshit. Yeah.
I mean, I'm
Probably.
sure even 7 years, 10 years in, we'll still be stressed because you never know what's gonna come in.
Right. Exactly.
Cool. Well,
That's the
well,
scary thing about nursing.
yeah.
I know. The stress,
Everything's unexpected.
right?
I don't know how ER people could do it.
I don't know. either.
I could never.
Then I
Like Morgan, oh my God.
All right, that was it for the questions.
Okay.